this is Dr. Hashimoto. One of the things that we do here when we're treating lower back pain is we find that most of these patients are having some kind of inflammation or disc problem or pressure on the nerve. So we do something called a warm laser treatment on this. We also do something called a magnetic pulse therapy. And we also find that the muscles in the joints around this are going to be very, very tight. So the first thing that we do here with the patient is we'll have a variety of different vibration tools that we do this to kind of loosen up all the muscles in the joints. So we do that ahead of time. And then what we'll do is we have, for some people that don't like that twisting and popping, we have a little instrument that does this 12 times a second. Table can go up and down like this, and then we just very easily just loosen up the joints all the way up and down. And then we do traditional hands-on chiropractic for those that are used to it. We always do a full spine treatment. And then we do something called a warm laser treatment right here. We have a little guiding light right here. We put it against the skin, and we just do a warm laser treatment. It's just going to feel like a really warm light, and what it does is it stimulates the healing processes and it helps reduce any inflammation. Then after that, we'll go over some corrective exercises to reinforce all the changes. And then a lot of patients benefit from physical therapy exercises. Physical therapy exercises are great for reinforcing change, but unless we loosen up those fixated joints in the spine, you're always going to have a lot of pain. So we like to integrate some exercises with our treatment to reinforce the change. Common things like lift the belly up and then bring it all the way back down. So this is a cat-cow exercise. It puts some very passive motion in the spine. It helps coordinate between the glutes and the abdominal muscles, and we give you a series of exercises depending on the type of injury. So in our office, we're going to loosen up tight muscles, tight joints, reinforce that movement with proper exercise, and then we have different modalities to help reduce inflammation, to help you heal. And if you have a neck or low back problem with some kind of a disc issue, we'll traction that with spinal decompression. Those are some of the treatments that we do here in our office. So when patients are coming in with chronic low back or neck issues or mid-back issues, most of the time you're going to get irritation on these discs that irritate the nerves. So what we want to do is we want to stretch these apart with a traction treatment. We call this spinal decompression. And essentially we have a harness that we hook up over here, and the table will just gently pull and relax, just creating some nice gapping space over here. It's a very gentle way to alleviate pressure on the spine. Magnetic pulse therapy. This is called pulse electromagnetic field therapy. What it does is it has alternating magnetic pulses that will actually energize the cell membrane around your cells, and that's going to help get rid of inflammation and waste and also help your cells heal. We'll set up the little magnetic pulse therapy. Patients is here for about 12, 14 minutes, and it's just going to gently stimulate healing, reduce inflammation, and it's going to penetrate deep into those discs and arthritic areas where you have inflammation. Shockwave therapy sends acoustic waves into the tissue. It creates a little micro injury, and it helps promote healing in the tissue. So some of the patients, when they come in here, they're going to have pain in their wrists, elbows, shoulders, ankle, feet, neck, low back, things like that, and then we'll sometimes do shockwave therapy on it. It helps break up the scar tissue in there and promotes healing, so it's great for those people that are active adults, still doing all the sports that they want to, but starting to have some tendon pain.